Welcome to the Neural Implant Podcast, where we talk with the people behind the current events and breakthroughs in brain implants in an understandable way, helping bring together various fields involved in neuroprosthetics. Here is your host, Ladan.
But yeah, guys, pleasure to be talking to you. SFN 2019, we're here. You guys are looking at the beautiful view of the Lake Michigan. And best view in the house, honestly, because we're inside a lot of times inside the exhibit hall, and people have compared it to a casino where like no clocks anywhere, and you don't know what time it is, and people are like, "Oh, it rained yesterday or it rained today?" Like I had no idea. But do you guys want to introduce yourself a little bit and what you guys have been doing here?
Yeah. Why don't you start?
Okay. I'm Buzz Shimoleski. A little bit about myself. I broke my neck in a surfing accident back in 1988. I'm a C5-6 incomplete spinal cord injury. Let's see, I went from having hardly any to no movement or feeling after surgery, got my sensation back through just being hard-headed, working hard, got my strength back to where I went from being completely dependent to 100% independent. Started playing sports again, started working, getting back to a normal life to where, I didn't have to rely on people to do my daily stuff. So got back in the swing of things, working, enjoying life, and then started doing a lot of peer counseling to help other spinal cord patients and their family. Then a PT friend of mine sent me the information about the research program. So that's how I got involved with the Hopkins stuff. So.
And we're doing audio only, so you have to describe that you have 3 implants sticking out of your skull, and you got a sense of humor too. So you got 2 of them as horns, like devil's horns. Yeah. So you was it Hellboy, or who are you comparing it to?
I wasn't comparing it to anybody. I know who those like Hellboy and stuff are. I'm not a big cartoon person, but yeah, some people were like that. But I made the comment of, I'm kind of that happy horny devil type thing. So, not that the implants weren't cool enough, but, if I was going to rock them for at least a year, I had to have a little fun with them. So that's where speaking with all the people involved with the whole, research program, they were like, oh, the engineers, we can do this. And so we came up with the horns. I have a set of eyeballs. What else? I got a set of the rabbit ears.
So you had them positioned, you asked them to position it in the place on your skull to have fun with it.
Oh, well, yeah, if you want to get to that, that was one of my things too. When I first came aboard, they told me, we got to do this and that. And that was one of my things too, is if I got to wear these things for a year, I don't want them in oblong places, or I was like, they either got to kind of be like a mohawk style or kind of devil horns, so I can have fun. So they came back to me after a couple of weeks of doing the stuff and kind of gave me my choice of where the implants could go.
That's awesome. So, that's really cool. Dr. Celnik? Celnik.
Yeah.
You want to introduce yourself?
Sure. So I'm Pablo Celnik. I'm the PI of this project that we've been working here with Buzz. I am a rehabilitation doctor and a neuroscientist. I have been working in Hopkins for many years, and I'm the director of the Department of Physical Medicine and Rehab at Hopkins. And this is a great collaboration and partnership. This is very much team science. So we have folks from the School of Medicine, from the Department of Rehabilitation Medicine, Neurology and Neurosurgery and Plastic Surgery. And we also have a large team coming from the Applied Physics Lab, APL at Hopkins, with many, many names and many, many students. So yeah, it's been a fantastic journey that we have gone through with Buzz. So it is much to talk and a lot of excitement. So Buzz has been a perfect candidate for this type of work. It's not easy to find people who want to volunteer their time and effort and body to this type of science. So you need to find the right person. It's not easy to find the right person, but we connected with Buzz, and it's been fantastic. He's he, as you can tell, he has the right attitude, the right personality. He has the altruistic approach to the story, where he knows he's doing this for the greater good, maybe not getting direct benefit, but in the process, we're having a good time, we're having fun. He's one more member of the research team. We told him that was going to happen early on, and actually it did happen. So he's an important contributor in the work that we're doing. So just to follow up on the story, his decoration. So one of the conditions that Buzz said is, okay, if we want to do this, I need to have some. He asked from the get-go, can we have some decorative things? And like I mentioned, we have a plastic neurosurgeon involved in the team. It's a plastic surgery, but it's plastic neurosurgery, subspecialty. His name is Chad Gordo. So he's been a great partner with Buzz, and we talk about, there's a lot of things that go through the plastic surgery side, wound care and management and so on. So early on, we showed him some drawings of potential setups for the implants. So we had to negotiate a little bit what we can do or what we cannot do. And then we have 3D printing of his of this for the pedestals, to decorate the pedestals and so on. So it's great fun to twist in the story.
That's really cool. Yeah, that's awesome. I mean, you gotta have a little bit of fun with it, and then to 3D print it is just, a tiny 0.0001% more, and you can have it just makes it that much more approachable, I guess.
Right.
So we just finished up a panel with BlackRock. We did one yesterday as well, and basically talking to the implantees. So there's Ian, and he was implanted in the motor cortex, and then Nathan in the motor and somatosensory cortex. And then, so what's special about Buzz? What is new, I guess, with him?
Yeah, so the main difference is that we implanted Buzz bilaterally. So he has more arrays than other folks in the past, Ian and Nathan. So he has 3 pedestals, 6 arrays. 4 are in the dominant side and 2 in the non-dominant side. So he has both bilateral motor cortices and bilateral somatosensory cortices. So that's the main difference, the 3 pedestals and the bilateral implantation.
So he'd be able to control both hands, 2 hands with this then, right?
Right. So one of the main goals, big picture goals of the science that we are working with Buzz is in control of bilateral arms. So we have, the main concept is what can we do, using bilateral implants to bilateral arms. There are a couple of straightforward advantages of bilateral implants. You have more electrodes implanted in different parts of the brain, so more maybe potential data sources to do the BCI work. But there is also complexity of questions that you can ask about bilateral arm control. Whether it's truly needed to have unilateral versus bilateral, and you cannot solve that question until you try and test those potential gains. So that is an obvious element. And then there are other questions related to bilateral arm control, which comes with multitasking. So what degree of multitasking can we do? So here we're testing 2 anthropomorphic elements, the prosthetic arms. But then you can say, okay, what if we could control 1 arm and 1 something else that is not anthropomorphic, or 2 non-anthropomorphic elements and so on. So there are questions of multitasking and control that you can test, you can ask with this setup.
That is actually really interesting. 1 anthropomorphic and 1 not. Okay, so we're here in, October of 2019. You were implanted in January. How much research have you done, or how good are you at controlling so far, and what's the experience been like so far?
For me, it was a little boring in the beginning, but that's all the computer stuff going on. But from the feedback that I've gotten from, my guys and girls, I call them my computer folks, just from their reactions, their non-reactions and stuff like that. And even after, they don't react, they try not to react during a session, because they don't want to kind of bias me, good, bad, or indifferent. So, but I've learned they don't have very good poker faces. But we've done some training, quite a bit. I mean, but according to them, I've picked up things pretty quickly, and we've rocked a lot of the stuff out that even when we kind of run into a problem, we kind of figure it out pretty quickly. That it can be a little stressful sometimes, especially with the brain. There's a lot of unknown with it too. Or just as I think I've gotten something mastered, it does the complete opposite. I'm dedicated to do it. I'm very, competitive even among myself to get something done. And once I put my mind to it, I'll do whatever it takes. And according to what I've heard, from Pablo and the rest of the team too. A lot of the stuff, some of the stuff's never been done before, never been accomplished, and we're knocking it out, and that just makes me want to do more. So
that's really cool. And how often are you going into the lab?
3 days a week.
Okay.
For like 3-hour sessions.
Oh wow. Okay. So yeah, in these 9 months or 8 months or something like this, that would mean like 200 times. So what's the experience been like? What have you been doing, and is it tiring, or what's a typical session look like?
When it first started, when I didn't know what I didn't know, type stuff, because that was the mystery in the beginning. Was, I said, well, what do you want me to do? Or how do I do this? And we can't tell you. I'm like, well, how do I know what to do? Well, no, it's not that we don't want to tell you. We just can't tell you. So in the beginning, it was a whole lot more frustrating and tiresome, just because, you see things on TV and they kind of give it that magic eye, like, I'm going to make it move. It's basically what I was trying at first. But once I started kind of relaxing, and even to this day, and I tell them I feel bad that I can't explain it more, the way I make my arms and the hands work is I'm thinking, but I'm not thinking. And especially on new task days, I'm not necessarily physically tired anymore. First couple weeks in there, I was physically tired. Roll out of there after 2 or 3 hours and just wanted to go lay down. Now it's a mental workout, and it's a good feeling. I mean, it's like a good workout. I roll out of there tired, but it's like, oh, today was a brain day, exercise in the gym type stuff. So, and with science, there's nothing's perfect. Just when you think you got it straightened out, something comes along and changes it. So I'm going to say 95% of the time up to this point, everything's been good, been fun, but I mean, you got to have some bad days that's part of science. Even a bad day is a good day. At least that's what I've learned so far from the scientists. So
it's like, oh, our hypothesis is incorrect. Maybe we have to approach it a different way. Maybe that could be the bigger learning experience.
Right. It's like, well, we learned something else, but we didn't learn this, but we learned something else today. So, but up to this point, it's been great. I'm loving it. Yeah. I mean, if I can be on the edge of, the new technology, creating something better, stronger, faster, I'm all about it.
So Pablo, what can you say about it? Or it's still kind of new, so you might not be able to talk about all the data or something like this. But what's been some kind of things that have been arising from this? What's some new data?
Yeah, no, I think very interesting series of questions I can ask when you have this bilateral setup and you're aiming for this bilateral arm control. The complexity of the movements that you do and the multitasking aspects escalate very fast. So Buzz has been, like he said, he's been doing great. He's been doing training on these decoders to control the arms. And early on, we started with one arm and then the other arm. And now we have been moving along very nicely with actually training bilateral arms together and increasing the complexity of bilateral arms movement. So, folks were arguing, it's like, okay, do you learn how to do one arm and then you add a second? Do you go for the two at the same time? And so you can ask some of these questions. In this type of science, it's complicated because it's an N of one. So, we are used to try and control for things that are. But in any case, at this point, he's been doing great. We've been doing some complex bilateral arm movements and so on.
So wait, what's the answer? Is it how do you do it? Do you train one arm or both arms?
At the beginning, we started with one arm just to make sure that things work, our setup was working and so on. And we gained certain level of dexterity in one arm and the other arm, the left and the right. But even before we were like having top level of performance, we jumped into the bilateral arms. And there was not a huge decay on his performance when we jumped into the bilateral arms. So now, for the last maybe month or so, we've been working with a lot of the bilateral arm control and so on. And then you can think about movements in phase and anti-phase and synchronous and asynchronous motion, and so you can really scale the complexity of bilateral arms to the level that even able-bodied individuals, we have a lot of difficulties. If you
like
think about
playing the drums or something.
Yeah, well, think about do a circle with one hand and a triangle with the other one, and you have some contamination of the two motions. So even for an able-bodied individual, it's very complicated to do this type of thing. So you can really go up in the complexity and make it really, really hard in anybody. So but Buzz has been doing great on his training and the performance of the bilateral arms. But the other aspect that I want to also point is that we have recorded and stimulated electrosols and somatosensory cortex. So a big component of the time that we've been working with Buzz is in somatosensory, percepts and so on. So feeding back some percepts directly from the MPLs, from the modular prosthetic limbs. And that's also a series of very nice experiments and some breakthroughs because, again, the special setup we have with him, for instance, the idea of, he can identify very nicely the different digits that you touch, but then you can also do simultaneous bilateral hand stimulation and so on. And Buzz has been very accurate in performing this type of sensory tasks as well. So it's exciting, and the road ahead is wide open. There's many questions to be asked.
So what is the road ahead, I guess? I mean, you've been doing this for 9 months. You've been talking about like, okay, this is a sure thing for a year, but you don't really know like how much longer, because it has to be approved year by year or something like this, or what does it look like?
Yeah, so at this point, like any other research team, we depend, a big component is support. So obtaining the funding support to do this type of work. So we have for a year, and we have an extension likely for another year or so to come. So there are questions related to control, both to control of bilateral movements or control of non-anthropomorphic things, as you do anthropomorphic things. And then there is issue of sensory stimulation and sensory looping into the motor control. So people have been testing some of the things. Some other groups have been testing how the addition of sensory information helps you with motor performance. So we are planning to do some of these activities as well, but in the concept of the bilateral arm control and so on.
Wow, very cool. So you're excited, Buzz, about potentially another year or something like this?
Oh, absolutely, yeah. I mean,
you do this forever if you could, right?
At this point, yeah. I mean, as long as I'm still having fun and we're learning and it's making things better, yeah. I mean, it's, like I said, it's very cool and exciting to be on the cutting edge and then kind of going above the edge to doing these things. So it's, I don't do things for notoriety or, oh, look, I'm the best of the best. But when you can kind of throw that out there every now and then that, hey, I was the first one to do this. Or, I'm the one that started that because now we're here. So it's, I get more and more excited, even on the bad days. Not that there's that many of them, but yeah, I mean, I'm loving it. It's a lot of fun. On my other part of the team, they, I try to make them have fun while we're in there too.
Yeah. So Buzz is like I said, is a great research part of the research team member. He's pretty awesome, and he's a special guy. He knows that, but one of the pioneers with another group of individuals that we met and we were interviewing this week that are really open up new frontiers in a field that we all think has great potential for growth to help people with disabilities. So we are very grateful for the work that he's been doing. It reinforced the successes, the small successes, and reinforces the good work that he's doing and his partnership. So, but it's very important. The big picture is very important work to open up a new field of that to help others.
Yeah, you've been doing patient advocacy, right? Like, so do you want to talk about this a little bit?
Sure. It's been one of those things that I did early in my early days of my spinal cord. That every so often I'd get a phone call, hey, this. But at one of the other facilities that I deal with, we have a mentor program that we go in and talk to folks that are the same type of level of injury as us, same sex if we can. If not, if there's nobody around, and I'll have no problem going and talk to a female about, basically a quad is a quad when it comes to that type of stuff. But it makes a world of difference just in the recovery phase of it too. Just with the way healthcare is now, back in my day, I was inpatient for almost a year. So I was in the hospital, had a chance to kind of absorb a lot. Now, a quad inpatient, 2 months if you're lucky, which, in my opinion, that's just ridiculous. Because you go from being a normal human being to an infant again, to where you're learning everything. So as like a peer mentor. I go in and, I'm very direct with people, very honest. It's like, okay, you're in a situation that it sucks, it happens, but it's not the end of the world. Here I am, I'm 32 years post mine now, but up to this point, I still travel. I'm 100% independent. I work, I play, I drive, and it's a lot of stuff that you think especially as a young patient, oh wow, I'm never going to be able to drive again, or never going to have a boyfriend or a girlfriend, or I did that when I was first hurt. I was the jock when I got hurt. So now it's like, oh, what am I going to do? Sit in the house and just watch TV all day? But there's plenty of sports out there. There's other, competitive sports, recreational sports. And that's why I do what I do. I go in, and in the darkest moment of that particular family's time is I show them that this is just a minor setback at this point. There's still plenty of life to live. There's nothing that's stopping you. You may have to find a different way to do it, but there's still tons of life left to live. There's still lots of fun to have.
They're probably desperately in need of this message. They're probably very down. But, you bounce back and you kind of maybe become your normal self back again after a while.
I don't go in there and go, all right, you had enough time. Just get over it. Let's start smiling again. Yeah, you got to go through your mourning periods, and you're happy, you're sad, you're pissed off and all that. But you had those days before this situation. So, you take your time and deal with it, and you got to make the most out of life while you're still here.
Well, guys, this has been excellent. I've really enjoyed this. Thank you so much. Is there anything that you guys want to finish with or mention that we didn't talk about?
Not that I can think of.
No, I think this is great. I really appreciate the time. I think that, and the work that you're doing, highlighting this type of work and the work that, these teams, we had in many academic institutions, we're having, I think it's very important. It's going to really open up, like I said earlier, frontiers for people with disabilities, and also unveil some other very cool, interesting neuroscience that can help other domains as well. So thank you for inviting us for this conversation.
And if I can help anybody, like I said, that they can get a hold of me, I can help out whatever needs to be done.
Excellent. Yeah, thank you. This is absolutely great, and Pablo and I were in a privileged position because we have access to people like you, patients like you, but a lot of students or researchers, they don't, and for example, today's panel, like, people have never seen somebody like you, and they just they have such basic questions for you, right. But, and so this is kind of one way to do that virtually. Of course, meeting you would be better. Kind of, plant some seeds, and some people can be really inspired by it. Like, that's what they were saying at the BlackRock booth, the employees there is like, wow, we could be changing some careers, and people could be inspired to go a certain path after hearing people like you. So I think that's really cool.
Well, that's one thing that I also teach at the PT school and the OT school in Baltimore I've changed that curriculum over there, because it used to be just the professors, but I used to go into a 1 day a year as a patient day, to where, here's all the students, they're now, here's a real patient. To where now I go in as a patient day, but then I'm now teaching when they're doing their spinal cord block of different things, whether it's wheelchair mobility, different aspects of their learning areas, to where, I do on socialization, sexuality, to where they're hands-on with everything. And just over the last, 12 years I've been doing that, the professors have said, the grades have gone up, the comprehension has gone up. My real big payoff is when I go to some of these, they have fundraisers for their class or a party, and I have their mom or dad come up to me at the party and go, oh, are you Buzz? And I'm like, well, yeah. And they're like, thank you so much. My daughter or my son was having a hard time, but they said after they talked to you or spent time with you, their comprehension of that really clicked. So now they know they want to go into pediatrics or in the spinal cords or in the stroke. And, they didn't stop talking about you, but, it's great to finally meet you. Thank you type stuff. If it wasn't for my PTs, my OTs, my docs, I wouldn't be where I'm at. So it's kind of my way of giving back, but it's also a way of kind of paying that forward too, as far as, showing what their job is does really pay off. in the long run.
You know, this what you're saying also translate, because you impact the clinical community when you are doing that type of work, but now you're impacting the neuroscience community because you are a vivid example of applied neuroscience. I mean, we are doing discovery and research, but we have direct application to human activities and health. So it's a very beautiful way of translating directly your neuroscience to a practical application. And you guys are vivid demonstration of that this is happening. And hopefully, by the work that you have been doing here in SFN, will inspire other neuroscientists to take a look at this piece of the field and encourage them to jump into this.
And then you get to have more hands-on sexuality talks.
People laugh about that, but I wouldn't mind getting paid to be the sex guru for spinal cord. So it's an important subject, but
because you were saying before, like, it still exists even after injury.
A lot of people don't think about it, but it's the sexuality part after, not just after spinal cord or stroke and stuff. It's a big thing. Even it's funny to watch some of the younger students, when you say, well, even after, grandmom or grandpa has a hip replacement or knee replacement, they may be a little older, but they're not dead. So they're like, oh, stop. But that does come up. I've seen, patients that had a hip replacement and they're 50s, 60s years old. And how long before, my wife and I can have fun again? Or in the meantime, can I bend my hip or my knee a certain way type stuff? So it's out there.
Okay, and with this image, I think we will.
There you go.
Everybody's image in their head. I think we'll finish up. Thank you so much, guys.
Thank you.
Thank you.
Thank you, Ladan.
Hope you enjoyed the show and were able to learn something new, bringing together different fields in novel ways. Until next time on the Neural Implant Podcast.